Hello everybody, Liz Stockley here, CEO of the BDA. I'm here this morning with Venus from NHS England, and we would like to talk about the AHP's Deliver strategy and also the BDA's new strategy. Venus, would you like to introduce yourself?
Brilliant, thank you, Liz. First of all, can I just say thank you very much for having me today. Great pleasure, really. So my name is Venus Madden. I am the current clinical fellow to our Chief Allied Health Professions Officer for England, Suzanne Rastrick. So I've been in this post for around a year and a half, and it's been fantastic.
Thanks, Venus. We're going to start by talking about the AHP workforce as a whole and a number of initiatives and projects that focus on diversifying, developing and expanding that workforce to ensure accessibility and also, very importantly, retention. To start off, would you like to talk us through the AHP's Deliver strategy and what's in it for our members?
Brilliant, thank you. So with the AHP Deliver strategy, it is written for colleagues that actually work alongside with any patients that receive NHS service. And it is just to actually say, I am aware the BDA actually cover members across 4 nations as well, but the strategy is actually set out for AHPs. It doesn't matter what role you've got, from students, support workers and registered colleagues within England. Now, having said that, I have to say AHP Deliver actually got quite a lot of areas that aligned with your new strategy. So that's actually really pleased to hear. I guess a couple of things just to talk about in AHP Deliver is really about our enhanced foundations. So we got AHP, our commitments to talk a little bit about how we can increase diversity in the leadership role, and actually how we can support people to actually feel that they can do the best that they want to be. We also talk a little bit about AHPs being in the right place at the right time and delivering the right care for our people and communities to meet the population needs. We also talk about our commitment into digital areas as well, which I know that we will be talking a little bit more later. And then the 4th foundation is really about how we can focus on research and study to ensure that the practice and the care that we deliver is evidence-based. We have got 5 focus areas that from the strategy as well, that we have got a commitment and also ambitions in there as well. So we talk about people first, putting everything that we do, and by people we mean anyone that receive our service, carers, any significant others, but also the communities, and communities include everyone. It doesn't matter what background they're from. And I think one of the questions that we ask quite a lot, and I'm sure that the aesthetic colleagues also ask a lot as well, is what matters to you. Yes. So that's actually one of our focus areas. And the second focus area is about optimizing workforce. So again, I know that we're going to talk quite a lot about our work and how we can actually support the members to actually do the best as well. And then we talk a little bit about sustainability, social justice piece, and that's actually something that we're very passionate about. And then so the 4th one is really about environmental sustainability. So think about the AHPs, how we can cause impact in that area. And the final one is really about strengthening and promoting AHP community. So as you said quite earlier on, it's really about how we can support our dietitians and our dietetic workforce to be more visible in different settings as well. So that is quite, I will say, a glimpse of what the strategy and actually what the members will be able to drive that forward.
Thanks, Venus. That aligns nicely with elements in our new strategy around developing and growing the workforce, around education and research, and also looking really at the breadth and depth of the different careers available in that space. There's a number of things that we're doing, particularly in terms of growing the diversity of the workforce from the grassroots. We're looking at how we work with different pathways into the profession, including apprenticeships, which I know is important to you guys as well. And we need to make sure that we're doing that consistently across the 4 nations. We're looking at as well developing the top end of the career path, the advanced practice space and apprenticeships in that space as well. So we're looking at developing practice-based learning in the as people are coming into the career, so that we can really introduce the breadth and depth of the career from the starting point. So we've talked a lot about the development of the workforce in both of the strategies. Would you like to talk to me about the strategic influencing role that you're playing?
We probably can start from talking about strategies and policies, so more from the wider range. And so as you actually know, from a national's point of view, our Chief Allied Health Professions Officer, Suzanne Rastrick, Suzanne has actually been lobbying and actually talking to different organizations and our partners as well to think a little bit about how we can further champion our AHP, and obviously it does include dietetic workforce as well, to think about our impact and the work that we do, and to actually think a little bit about the skill set and experience that we will be able to contribute towards working towards delivering the best care to meet the population needs. We also do a lot of work very closely with our colleagues in Workforce Training and Education, WTE Directorate. So they actually used to be the old Health Education England, HEE colleagues. So we actually do a lot of work to ensure that we provide the right resources, and that include from webinars, from anything online training, various bits and bobs, to actually ensure that our members and our colleagues have the right tools to actually help them. I particularly like what you actually mentioned about, I'm aware that BDA is currently doing quite a lot of work to ensure that it doesn't matter, as I said, what level you're at, you're actually developing them and actually stretching them. So some of the work that we actually been doing quite a lot as well is to showcase our colleagues.
Yeah.
So when I talk about showcase, that's a few soft and hard way to actually do it. So some of the ways that actually we've been doing, as I said, is more strategic with strategies and policies. And I think the other things that we do quite a lot is more about public education. So as I said, we work with different colleagues and HEI, higher education institutes, to actually talk about and can ensure that the curriculum and the work that we're doing we will be able to equip our future workforce that actually meet the needs. To actually do the best job that they want to do. So I think there's quite a lot of work happening. But I think one of the things that you also mentioned about the apprenticeship and support worker as well is we're very, very keen to ensure that we don't leave anyone behind. And we have got colleagues that are actually very keen to go up to the ladder, so we speak. So as you said, they probably want to do the apprentice, they want to actually do the enhanced practice, and then advance, and then to the consultant level as well, which I know some of the dietetic workforce. But we also have got colleagues that are very happy in what they're doing, but they also consider how they can actually do better. So I know that BDA actually has got quite a lot of resources that to support colleagues, and this is something that with our national team we work very closely to ensure that we can support you to do that.
Yes, we have developed a lot of resources in terms of supporting particularly first contact practitioners. Also we're working on a programme of support for dietetic support workforce, and looking at the resources and tools required to support in the advanced practice space as well. One of the other things that we're doing that aligns with the philosophy behind both strategies is the development in the research space, and then making sure that we're growing that evidence base to support the development of the profession, and we like to showcase, you talked about showcasing Venus, we do like to showcase that at our research symposium.
Brilliant. And I think this is one of the areas that we're very keen to discuss and actually to drive as well. As I said, this is in our strategy, is that research is not necessarily about peer review research, and I know that you guys been working very hard to actually change that language as well, is to get everyone to be involved and actually think about their role and how they can actually showcase and actually make sure that they publish as well, because we have got a lot of forum. But I think one of the things that I actually recently met a few dietetic colleagues that they actually work as AHP research lead in their own organizations, and I think that is something that we really want to showcase and actually champion for their roles and impact furthermore.
Yes. Thanks, Venus. The other important area, of course, in developing the workforce is about digital competency and the digital space. Would you like to touch on that?
Well, first of all, again, I'm really pleased to actually see that BDA has been one of the pioneering force behind. We do have digital AHP platform for informal meetings that we actually invite all AHP colleagues, especially those who have informatics and digital portfolio, to join us to have some conversation. So we are very keen to actually continue keeping that. One of the things that I know that you are doing as well is to have your digital strategies coming out hopefully early next year.
Yes.
So that's something that we are we will be in full support and ensure that we actually talk about that in our forums as well. And I guess the other things about being digital and actually I was listening to one of your colleagues. Jacqueline Walker, who actually did
the Elsie Widdowson lecture.
Yes, and that was very fascinating. I actually find it very inspirational because one of the things that she mentioned is about dietetic workforce. It's not about all or nothing. It's really about how you can use digital to ensure that you can be inclusive and actually work with wider patients and carers as well.
Yes.
So that's something that, as I said, we'll be very pleased to actually hear. Looking forward to hear more. So the other things that I'm very pleased to actually hear as well is with BDA as well as CSP and a couple of other professional bodies. You guys have been working very, very collaboratively, closely together to deliver. Well, to co-produce and actually deliver e-learning to support our dietetic workforce to think really a bit about their roles and their responsibilities in how we can drive the informatics, how we can actually drive data to ensure that the work that we do is evidence-based and actually have that effective outcome measures as well.
Thank you for touching on our digital strategy that will be released in 2024. We also have a significant project underway to look at record keeping and how we can support more consistency across the dietetic profession in that space. So thank you, Venus. We've talked about development of the workforce. Another area that's really important to our members is developing leadership. So I wonder if you'd like to talk to us about how you came into your role and what's your background?
So I am an occupational therapist by background, and I've been actually working in clinical for a long time, and then I gradually moved up to do more like a service lead role. But I think I was a little bit stuck at one point, thinking a little bit, I have got 2 young children as well, and I wasn't very sure where I would like to go. But I know what sort of skill set I've got, what sort of experience, and I'm very keen to actually do something for every AHP professional groups as well. So I was thinking about, let me explore a little bit more. And then this post actually came about a couple of years ago. Initially, I wasn't very sure whether I would apply for it because I have heard from the grapevine that actually this is a very competitive role. And I just thought to myself, maybe I'm not good enough. And I think we talk about that imposter syndrome.
We do all suffer from imposter syndrome, I think, yes.
So we talk about that quite a lot. But I was actually very lucky because I have got a mentor who actually said to me, but Venus, what have you got to lose if you apply for it? And the fact that you actually got quite a lot of you got your, I think it's really important to think a little bit about your unique selling point, your USP. And so she was saying that if you think a little bit about what you can offer that could be different from other colleagues or other professional groups, then go for it. So I'm actually very pleased that I took her advice and actually just had that leap of faith.
Within the BDA's EDI committee, we call that your superpowers. Think about your superpowers and what makes you stand out.
Yeah, and so clearly I trusted my superpower, and I applied for the job. And actually, what these opportunities has allowed me to develop or to actually do is to stretch my strategic leadership skills a bit further, and to allow me to actually be able to zoom out to look at the bigger pictures. So when you're in the clinical world or in the service, as I said, the operational role, you don't normally think about strategic the strategies. You don't really think about the policy that behind, or the groundwork that you don't normally see, but I've actually seen quite a lot now. But apart from being able to zoom out to look at the bigger picture, but I feel that I'm also able to zoom in to actually pay attention to some fine details. So this opportunity has been great, really.
Yeah, I think one of the things that we enjoy as the BDA from the support of the fellowships, those in the fellowship roles, is the ability for you to provide the broader context and then also hone in on things that are being done well and celebrate those so that we can all share and learn from each other across the AHP professions.
At least that is clearly your superpower. It's just the way you say it, it's really nice. But I guess this is something that I've also really learned about our AHP colleagues, is that sometimes we focus on what we are good at, what we are familiar with, we talk so much about different developmental opportunities in the clinical area, advanced practice, consultants, but and I'm actually aware that from your new strategy, the BDA strategy, is really thinking about the feasibility piece, and it's really thinking a little bit about how you can provide, how you can support the dietetic workforce to actually have that transferable strategic leadership skills. And I think fellowship is actually one of the opportunities that you can really do to stretch yourself and actually think differently. We have also got a few different opportunities which I think align with your new strategy as well. So one which I'm actually very pleased to share is more from our national team we're doing is artificial intelligence, AI clinical fellowship, and that is actually open to everyone. To nursing colleagues, to midwifery colleagues, and actually AHP colleagues. So that is an opportunity that I'll definitely see.
It would be great to see a dietitian in that role.
Absolutely, and I think especially if you think about the contact that you guys have with the public, that is something that we want to actually promote. And we have also got a few roles that we actually, and Suzanne certainly has been very keen to promote. For example, the National Safety Advisor role, the National Clinical Director role, and we have also got a program that actually just came. I think it's actually just about to open application. It's called Clinical Entrepreneurship program that we know that we have got a different AHP colleagues. So as you said, can you imagine if you actually got a dietetic colleague in there to showcase, show that visibility? That'll be fantastic.
And obviously one of at the other end of the scale, we want to make sure that we're pulling people in, so the BDA is actually getting out there into schools and promoting dietetics as a profession, and providing examples of how far you can actually go in the profession over the next wee while to try and pull more people into the profession.
And I think that is great, because one of the things that we discuss, we talk quite a lot in AHP's Deliver, as well as the newly published, as you know, the NHS long-term workforce plan as well. It's really about stimulating interest. It's really about how we can recruit people. And for me, I think dietitian is a fantastic profession to actually go into, but it's really about how we can showcase how we can actually talk more about it, make it as an exciting, more exciting, it's already exciting, career for our younger generations, or actually people who actually done another career and they're thinking about changing career to consider. But I also like what you actually said about the diversity, because this is what your strategic direction is, to have a more diverse workforce. So it's really about how you can be more visible, and as you said, having some of your colleagues be role model to actually talk about what they have achieved and what sort of things that they've done, not necessarily in the place, the setting that we normally see is in the community or in the hospital, but actually you got, as you said earlier, you got the first contact dietitians, they work in primary care, GP surgeries, and you also got a small amount of colleagues actually work in social services and education, academia. So that will be, I'm sure that someone will actually find an area that they would like to join in as well.
And we're also, you'll have seen in our strategy, working on return to practice and trying to encourage people back into the dietetic profession, and getting them to explore the breadth of roles that are available. So Venus, you touched briefly on diversity. I know that growing diversity is a very key golden thread that runs through our strategy and also in the AHP's Deliver programme. Would you like to talk to me a bit about how you're focusing on growing diversity?
So I think the first thing that comes to mind, which I probably haven't really covered earlier as well, with AHP Deliver, we have got two overarching principles. One is actually co-production, and the other one is anti-racism. So when we talk about diversity, I think majority of the people will think about EDI, equality, diversity,
yes.
and inclusivity. So that is something that actually, as you said, we're very keen to actually look into. And for us, diversity means every AHP professional group as well. So it doesn't matter how big you are or how small you are. It's really about how we can work collectively to provide the best care to the patients, to the community. But the other things that you probably would know as well is that we got our NHS EDI improvement plan that actually released a few months back. And we did quite a lot of work in there because we are aware that we got work to do to drive the diverse, to make sure that our workforce is actually more diverse. And actually that starts from, as you mentioned earlier, from school. So we want to actually ensure that we go to different school, especially the deprived school, because of their culture, because of their belief. They might not necessarily choose AHP as their career. And so that's something that we want to do, is to do the promotion, is to raise awareness, to teach the public, to educate the public that actually what we deliver, what we do. But I guess the other thing about diversity as well is really about ensuring that we always say that bring whole self to work, isn't it? So it's
Yes.
really about how we can encourage members, our colleagues, to feel that they actually they are doing the best they can. They feel happy at their work. They feel that their talents, their superpowers is being fulfilled. They can actually really develop. So I think that's something about that. And then the last thing is really about the cognitive diversity as well, because
Yes.
we often think about diversity as
That
just
diversity of thought is so important.
yeah. And I guess the dietetic workforce really demonstrates that because of the breadth of work that you guys do, and as I said, the traditional settings that we think we actually. Well, as I said, it still surprised me actually where I can actually see a dietitian. So I think that's something about how we can promote that, how we can actually really champion that, and how we can cleverly use some social media, for example, to actually ensure that we get our public, we get our next generations, or as you said, return to practice colleagues to actually really think how they can contribute to make the society better, really.
Yes, thank you. The final golden thread that I just want to touch on is the golden thread that runs through our strategy in terms of having a positive impact on the planet. Now you'll know that dietitians' role in this space is multifaceted. We have a responsibility as a professional body to be more sustainable. We also have an opportunity for dietitians working with people to have an influence over how food and nutrition and hydration can affect the environment. And we also have the ability to have some influence over the whole food system. So for dietitians, this is a really, really important point in time, and we've got a lot of work to do. How is NHS England working to support AHPs in this space?
Well, I think we actually been having quite a lot of different type of work happening, as you know. But one of the things before I actually forget is we do need to mention, when it's dietetic workforce, the One Blue Dot
Yes, the
campaign,
One Blue Dot campaign,
which is absolutely fantastic, and it's actually been going on for a little while. But actually, the fact that you guys continue to update it, to actually
Yes.
change. I think that's actually fantastic, and I think one of the fantastic thing about the One Blue Dot as well is that it's for everyone.
for everybody.
It's for
Yeah.
everybody. So that's something very special about that, and we continue to actually champion that for you as well.
Great,
from our
thank
nationals team. And I guess a few things when we talk about sustainability. I think we talk about sustainability for the workforce. So the fact that you actually you are making a huge impact in the food system. You are making a huge impact in environmental sustainability. That really tells you something about the workforce. And I think for individuals who are actually thinking about doing something for the climate change, doing something, this is something that they will be able to consider contributing. And I guess the other things that we actually do quite a lot again, we provide that strategic influence. So it's fantastic to actually see the Sustainable September that actually BDA organized, and you have got lots of engagement, which is fantastic. And again, as I said, that is actually one of the superpowers that actually BDA members have got. So from our sort of like perspective, we have got our brilliant Greener AHP week this year, first time ever, because we have actually received a lot of comment from our AHP members, and just to actually say, Green AHP week was actually not joined by not just AHP in England, but we actually got AHP across different nations.
That's fantastic.
And in fact international as well. That actually people talk about the work that they've been doing and small acts that they can all do to actually make a change to the environment, sustainability, and hopefully we'll have more furthermore actually engagement from BDA members as well, because we'll be having it again next year, which will be fantastic. And I think the other things that we've actually done, just to actually say at first, I know that the BDA, you have actually updated your the work that you're doing, including sustainability in the curriculum.
So the BDA has included sustainability in the curriculum from next year going forward.
Yeah, and clearly that is something that is very important to your members as well. So for us, we've actually worked very closely with HCPC and with the newly updated Code of Standards, and especially with the preceptorship guidelines as well that are hopefully they will be coming out. They all include sustainability and to actually talk about our roles, our responsibilities, and actually what sort of things that we should be doing to actually help to drive that as well. And that is essentially we are trying to drive that net zero ambition that we have got. So that is actually really fantastic to see colleagues joining in.
Yes. Thank you, Venus. Listen, I'd like to say a huge thank you to you for coming to join me in the BDA office today to talk through. We've talked through a wide variety of topics around your strategy and our new strategy, covering workforce development, we've covered leadership, we've covered diversity and sustainability, and they're obviously things that we're all working on together and learning from other AHPs in this space as well.
Brilliant. And thank you very much for having me, Liz. It's been great to actually have such a fantastic, engaging conversation. And thank you.
Our pleasure. Thanks, Venus.